Hi, I'm Michele Shermak. I'm here to talk to you today about getting some revision work on primary breast reconstruction. Breast reconstruction is an area in plastic surgery that is very near and dear to my heart. I did some extra fellowship training in this down in Nashville beyond my training at Hopkins, and came back and have maintained a nice breast reconstruction practice through my career. I did a lot of primary reconstruction in combination with mastectomies, and am now moving on to more of the revision work. Just a couple of things I wanted to go over. Number one is that breast reconstruction is not a forever procedure, and it is not uncommon or unreasonable to come in after having had a primary reconstruction to try to kind of zhuzh up the result and make it more aesthetically pleasing. There's a lot going on at the time of the initial mastectomy and reconstruction, a longer procedure, greater healing issues. These revisions tend to take a much shorter period of time, typically do not include drains, which is really important to know, and they're extremely focused time that the plastic surgeon can spend doing more artistry and gain a result that leads to something that is aesthetically quite pleasing. So much so that my patients have just become so much more confident and happy, with the way they look. Things that we do include implant revision work, maybe move to a different size implant, different width, different projection, a different type. Sometimes we do some breast lifting. Typically we do that on the opposite breast, and sometimes we can add in an implant to get better symmetry if there's just one side that had surgery. We do fat transfers to soften the look, which would include liposuction, typically on the abdominal area, which nobody seems to get disappointed by. There are all kinds of options, and I would definitely recommend, if you're kind of like, is this the way it should look forever? Come in, let's talk about it. I would strongly recommend we consider doing something to make you feel better about the way you look, and it should be a much more positive, self-focused experience once you're done with the whole cancer focus.